Hi, I'm Dr. Jennifer, and before you scroll past this video, I need you to pause for just a moment because what I'm about to tell you could save your foot, your mobility, or even your life. If you are over 60 or if you love someone who is, please don't treat this as just another health video. Treat it as a warning label because that's exactly what it is. Here's something that surprises almost everyone I tell. Diabetes doesn't always announce itself with thirst, fatigue, or a frightening number on a glucose meter. Sometimes the very first sign of this disease doesn't come from your blood at all, it comes from your feet. Think about it for a second. Your feet are the farthest point in your entire body from your heart. That means they are the first place where poor circulation shows up, and the first place where nerve damage quietly begins, often years before a routine blood test ever flags a problem. I have spent years in clinics watching patients walk in, convinced they had nothing more than dry skin or a stubborn cut that just won't close. And again, what we discovered underneath was blood sugar that had been silently climbing for months, sometimes years, completely undetected. That is the cruel, sneaky nature of type 2 diabetes after the age of 60. It doesn't knock loudly on the door. It tiptoes in quietly through your toes, and by the time you notice, it may have already been settling in for a while. So today, I'm walking you through 9-foot signs that could be your body's earliest warning system for hidden diabetes. Stay with me until the very end, because the ninth sign is one that almost nobody ever talks about. And in my experience, it's often the most telling sign of all. If even one or two of these sound familiar to you, please don't panic. But please don't ignore them either. Write them down. Bring this list to your next doctor's visit. Let's get into it, one sign at a time. Sign number 1, that strange tingling sensation, like your foot fell asleep, except it never quite wakes back up. You know that pins and needles feeling you get after sitting cross-legged for too long? Now imagine that same sensation showing up randomly, for no reason at all, while you're just standing in your kitchen making a cup of tea. That is not your foot simply falling asleep. That can be one of the earliest signs of something called peripheral neuropathy, nerve damage caused by years of elevated blood sugar slowly inflaming the small nerve fibers in your feet. I like to compare your nerves to telephone wires running underground. High blood sugar acts like rust, slowly creeping along that wire year after year. The tingling you feel is the static on the line before the call eventually drops completely. Sign number 2, numbness that sneaks up on you so quietly you barely notice. This sign is sneakier than tingling because there's no sensation at all to alert you. There is simply an absence of feeling where feeling should be. I had a patient once tell me, "I stepped on a thumbtack in my garage and I didn't even feel a thing until I looked down and saw blood soaking through my sock." That sentence alone should stop anyone in their tracks. If you can't feel a sharp object underfoot or a hot bath that's too warm, or even the seam of your own shoe rubbing against your skin all day, your nerves may already be struggling to send signals properly to your brain. I always tell my patients, numbness isn't peace and quiet. It's silence in a room where an alarm should be ringing. Sign number 3, a burning pain in your feet, especially at night. This is almost the flip side of numbness, and it can feel strangely contradictory. How can a foot feel numb in one moment and burning in the next? But diabetic nerve damage is a master of contradictions like this. Many people describe it as feeling like their feet are sitting just a little too close to a campfire, even though the room around them is perfectly cool. This burning sensation often gets worse at night, robbing people of restful sleep for months, sometimes years, before they ever connect the dots back to their blood sugar levels. Sign number 4, feet that are always cold, no matter how many pairs of socks you put on. If your spouse jokes that your feet feel like ice cubes even in the middle of summer, please don't laugh that comment off. Diabetes can damage the small blood vessels in your body over time, reducing circulation specifically to your feet. Less blood flow means less warmth, less oxygen, and less natural healing power reaching the tissue that needs it most. I often compare this to a garden hose with a kink in it. Water still trickles through to the other end, but nowhere near enough to keep the entire garden thriving the way it should. Sign number 5, and this is a big one, wounds or cuts that take an unusually long time to heal. A small cut on your hand might typically heal within 5 to 7 days without much thought. But that exact same size cut on a diabetic foot, it might still be open and raw 3 or 4 weeks later, Why does this happen? Because that same poor circulation we just discussed means fewer infection fighting cells and far less oxygen ever reach the wound site. This is precisely why doctors become so concerned about something as seemingly small as a blister on a diabetic foot. What looks minor on the surface can quietly become a serious, slow healing wound underneath, sometimes without the person even feeling much pain. Sign number 6: skin on your feet that is unusually dry, cracked, or scaly, especially around the heels. Now, you might think to yourself, oh, I just need a better lotion. And sometimes that's genuinely all it is. But persistent, unexplained dryness can actually be a sign that the nerves controlling oil and sweat production in your feet have started to malfunction. Yes, your feet have their own built-in natural moisturizing system regulated by nerves you've probably never thought about. When those nerves go quiet, your skin stops receiving the natural lubrication it needs, and deep cracks begin to form along the heels and soles. And cracked skin, unfortunately, becomes an open door for bacteria and infection to enter. Sign number 7: toenails that suddenly become thick, yellowish, or unusually brittle. Many people brush this off, assuming it's simply just getting older, or they assume it's a basic fungal infection, and sometimes that is exactly what it is. But high blood sugar creates the perfect breeding environment for fungus to thrive because it weakens your immune defenses while simultaneously slowing circulation to your toes. If you've tried over-the-counter antifungal treatments for months with absolutely zero improvement, that stubbornness itself is a clue worth paying attention to. Your toenails may be quietly trying to tell you something your bloodstream hasn't said out loud yet. Sign number 8: noticeable hair loss on your toes, feet, or lower legs. This particular sign catches almost everyone off guard every single time I mention it. We don't usually think about leg hair or toe hair at all until one day it simply isn't there anymore. But hair follicles require a steady, healthy blood supply to survive and grow, just like every other living tissue in your skin. When circulation to your lower legs begins to decline, hair follicles are often among the very first casualties of that change. If you look down one day and realize your shins and toes look strangely smooth and bare compared to how they looked just a few years ago, that is genuinely worth mentioning at your next doctor's appointment. And now, sign number 9, the one I promised you at the very beginning, the sign that almost nobody has ever heard of: changes in the actual shape of your foot. This condition is sometimes called Charcot foot, and it stands as one of the most overlooked, yet most serious, signs of long-standing undiagnosed diabetes. Because nerve damage so often reduces sensation in the feet, people can continue walking on small fractures or damaged joints for weeks without realizing anything is even wrong, simply because it doesn't hurt the way an injury normally should. Over time, this can cause the natural arch of the foot to collapse, or the foot to gradually develop an unusual rounded shape that we often describe as a rocker bottom foot. I've had patients tell me, almost in passing, my shoes just don't seem to fit the way they used to anymore, completely unaware that the actual structure of their foot had been quietly shifting beneath them for months. If your foot's shape, width, or arch has changed noticeably over the past year or two without any clear injury to explain it, please don't simply dismiss it as ordinary aging. Now, here is the truth I genuinely want you to walk away with today. None of these 9 signs are meant to frighten you. They are meant to empower you, to give you a kind of early warning radar that most people never even know exists. Diabetes after 60 does not have to mean a future filled with complications, amputations, or a loss of independence. The patients I see thriving well into their 70s, 80s, even 90s are almost always the ones who caught these whispers early. They listened to their feet before their feet ever had to scream for attention. So here is exactly what I want you to do today, right after watching this. Take off your socks tonight, sit somewhere with good lighting, and really look at your feet properly, the way you might look at any other important part of your body for the first time in a long time. Check carefully between your toes, check your heels, run your fingers gently across the skin, and notice, truly notice, what you can feel and what you cannot feel at all. If anything you saw today rang even the faintest bell of recognition, please schedule an appointment with your doctor and specifically ask about a blood sugar screening, an A1C test, and a simple foot sensation exam known as a monofilament test. These tests are quick, painless, and they genuinely have the power to change the entire trajectory of your health going forward. And if you share your life with someone over 60, a parent, a spouse, a close neighbor you check in on regularly, please do them a real favor and send them this video today. So often, the people we love the most are the very last ones to notice changes happening in their own bodies simply because they see those same feet every single day. And the changes happen so gradually that they become invisible to the person living inside that body. Before you go, I want to leave you with one important reminder. Nothing I've shared with you today replaces a real in-person evaluation by your own physician. I am giving you knowledge here, not a diagnosis. Think of this video as a flashlight, not a final verdict. It exists to help you see what might already be hiding quietly in the shadows so that you can bring it confidently into the light with a professional who can examine you directly and properly. If this video helped you see your own health and your own feet in a completely new light, please do me one small favor. Hit that subscribe button because every single week I break down the subtle early warning signs your body sends out long before any official diagnosis ever reaches your medical chart. Leave a comment below and tell me honestly, which of these 9 signs surprised you the most? I read every single comment, and I promise you, so many people watching this right now have felt exactly what you are feeling at this very moment. You are not alone in this. Take good care of those feet of yours. They have carried you through every single step of your entire life so far, through every walk, every dance, every long day on your feet. The very least we can do in return is finally listen when they try to speak to us. I'm Dr. Jennifer, and I will see you in the next video. Until then, stay well, stay aware, and stay one important step ahead of your health.